shin bone, the tibia, in the very front anterior, it has a part where there's no muscle on it because the muscle is medial and lateral. So when you're palpating, you want to feel where that bony ridge is basically, and obviously you're not pushing pressure on the bony ridge, but there's really good muscles just lateral to that bony ridge. So my fingers on the bony ridge, and right next to it, approximately a thumb width out, there's the tibialis anterior. And this is a really good muscle to sink into for runners who have shin splints, or really pretty much everybody. This tibialis anterior is the same area as the meridian, stomach meridian. So if I sink into the spots here, these are stomach points in acupressure. And if I use more forceful pressure, I'm sinking into the muscle. And then if I kind of lighten up and feel down the way, if I come to spots that are softer, more tender, squishier, those are basically depleted spots in acupressure that need a little bit of attention. So as I slide my way down, there's a couple spots that are softer, and I could hang out in those spots. I could hang out in them very gently and wait for a therapeutic pulse, or I could apply a decent amount of pressure. Now, you're going to accidentally find soft spots. If you're too close to the bone, you'll feel those little divots that happen over the years with little damages to the tibia. So if you're right on the tibia and you feel little depressions, those are not the same thing. But if you're in the muscle belly of tibialis anterior, you're going to come to soft spots. So the camera might even be able to pick this up. If I use pressure and I slide down, I sink into a divot right there. And the tissue's softer, so my finger kind of gets stuck in that depression. So right there's a more depleted spot that needs attention. There are many meridians on the leg, and I'm not going to talk to you about all of them today, but the stomach one goes directly with the compression protocol. And there's one more meridian that goes directly with the compression protocol. And if I medially rotate his leg, and I want to make sure I'm getting all the way from his hip and not torquing his knee, so I can hold his leg in medially, and I'm actually resting my elbow on the table, so I'm not having to hold it there. If I work all the way on that lateral pinstripe where the iliotibial band is on the lower leg, there's no iliotibial band, but that same line of fascia is a lateral anatomy train of fascia, and it also corresponds to gallbladder in meridian system. So if I work the middle of his lateral leg, that's another excellent myofascial line to work. When we talk about myofascial release, we'll treat a bunch of the lines, which some of them correlate directly to meridians. In general, for most people, you can use quite a bit more pressure on the lateral side than the medial side. Quite a few people are more tender in this area and this area. So if you're doing a lot of squeezing techniques, you want to be cognizant and more gentle on the medial side instead of using equally intense pressure on both sides. So you can use general compression, get those couple of lines, and then down to the feet. And then the feet, we know all kinds of great stuff.